Hi, welcome back. Today let's talk about interstitial cystitis or painful bladder syndrome. So why do we need to know about this? A lot of patients come because they think that they have recurrent UTI. Recurrent means urinary tract infection that is coming again and again, and they're getting treated for it. But a lot of times it need not be urine infection. It could very well be interstitial cystitis or painful bladder syndrome. So let's know what it is, how do we manage, and how do we know that is what it is. So what is it? It is a chronic condition. Chronic means long-standing condition of either it could be pressure in your bladder or pain in your bladder or pain in your pelvis too. Pelvis is lower abdomen, lasting for a few months at least. We say 6 months, 3 months, 6 months. That's chronic. It's a kind of a spectrum of a disease which also is included in painful bladder syndrome. That's why I called it together. So what are the symptoms? How do you know you may have it? It is similar to urinary tract infection. That is why people get confused. So when you go burning urine, painful micturition. When the bladder is full, you may have pain. You may have discomfort during sex. You may have pain in the pelvis. You may have lower abdominal pain for a long time, which you don't know the reason for. And you may want to go to urine more often, and every time you go, it may be a very little amount of urine. You may get up in the middle of the night also a few times to pass urine. The pain during urination is mainly when the bladder is getting filled that you get pain. That's why you want to go and urine. So these are all the symptoms, or how you know that you may have. What causes it? Why do you get it? We don't know the exact cause. We think a lot of factors contribute to it. Maybe even the lining, maybe we may have a problem, that is why. Could be food, could be lots of drinks that we take, lots of things. So basically we don't know. And what are your risk factors? Risk factors, if you're a female, then you're more likely. Age around 30 and above, most of the times it is not younger. And having some other chronic pain problems that can predispose to this. What are the complications of this? If it is long-standing, it can reduce your bladder capacity. It can lower the quality of life. If you're going to the toilet so often, if you're always in the pain or discomfort, obviously your quality of life goes down. And emotional troubles can be there, or sexual life can suffer. What do we do when you come to us? We ask you to do a diary. The diary is something that will tell me when you're having a pain and how much it is bothering you. So what does the diary involve? The diary involves what you're eating, what you drank that day, how much you drank that day, and did you have pain, how many times you have gone to the toilet to pee, and how much of urine you have passed, and when did you have pain. These are all the information that is there in the diary. So that helps. As I told you, some of the food can do that to you, and some of the drinks that you might be taking, like coffee, can be irritating your bladder and causing it. So we know by doing that what is irritating it, and so we can take it away and make you feel better. We will also ask you about your other medical problems that you might have had. It might be a urinary tract infection that was long lasting that has caused an irritation in your bladder. So we want to know about all of that. So bring all your reports. If you say urinary tract infection, we will ask you if you have had the urine tested, the culture done. If so, I want to look at the reports too. And I will ask you to go back and get another urine test done, just to make sure that it is actually not an infection that I'm missing. I may want to examine, make sure that it is nothing else, or I may want to have a scan done just to make sure that we are not missing anything else there. And we may sometimes ask to pass a small tube into your bladder with a camera and have a look inside. Sometimes we can even treat the condition with that same time. What we may do is have a look at it, see we think it could be that. Sometimes we may take a biopsy to diagnose it. Okay, and sometimes what we do, if we want to treat it, we may put a lot of water, stretch your bladder and leave it so that your bladder symptoms can come down. That's also works as a treatment. So we may decide to do it, and it's called cystoscopy. We may do some other tests, but most of the times the tests are only these ones. So how do we treat you? Yes, there are a lot of things that we can treat you with. We ask you to go and visit a physiotherapist. They can teach you some of the exercises for your bladder and pelvis, and we can give you medications. It could be just pain relief or some other medications that can help you with chronic nerve pain and things like that. There are also medications that we may want to put inside your bladder and help you get better. Sometimes it could be nerve stimulation treatment. As I said, the other medication is just to fill your bladder and stretch it and leave it. The same thing that can be done at the cystoscopy I told you. And very, very rarely we may do surgery to correct it. But how often the surgeries are successful is a question that we need to talk at the time and discuss. So these are all the ways we can help you out if you have a problem. The thing is that we need to diagnose it first. Okay. So if you think you're suffering with anyone, please do visit your consultants and see where we start. Take care. Bye-bye.